Hi, this is Dr. Hassan Barani. Welcome to the Ring Ohang Show. Last episode, we talked about the importance of treating eye trauma and the importance of early follow-up with these patients. Today, we'll talk about also a very important disease that affects the retina, which is diabetes. Diabetes is a very common disease, especially in the Middle East, because we are in the Middle East genetically predisposed to diabetes. And most people don't know that the diabetes affects the vision tremendously. We will talk a little bit about diabetes, what to look for, what are things to do if you have diabetes, and what are the treatment for patients who have problems with diabetes. Hi, today we are doing some surgeries on two patients who have diabetes, diabetes mellitus, and these two patients suffer from the same problem, which is hemorrhage inside the eye, inside the vitreous. So they have a problem where they have not have controlled their diabetes. So this causes a lot of problem inside the retina, and this causes hemorrhage inside the retina. So the first patient is Mr. Yahya. He's an 84-year-old male who has diabetes and uncontrolled diabetes. His blood sugars are 400, 500, and this sugar is very high for anybody. So because of that, and I don't believe that he got the proper Qatar, he's a 58-year-old male who actually doesn't know he has diabetes. He came to me complaining of floaters or blackness in his vision, and then when I examined his retina, it appeared that he has diabetes in his eye. So he also has some hemorrhage inside his eye. And when we send for his blood test, it appeared that he has actually diabetes. So he has a big problem also. So this is today our show talks about the importance of early diagnosing and treating diabetes. It's a very common disease here in the Middle East, and especially in Kurdistan, because a lot of people have diabetes and they don't control their blood sugar, they don't check their blood sugar, they don't follow up with their own internal medicine doctor. So this is a very important thing, and as you know, diabetes is hereditary, so it moves from one generation to the second. So we will today we will do the surgeries for them, and these surgeries are very important. These surgeries are called vitrectomy, and we go inside the eye, we clean the hemorrhage, we clean all the fibrosis on top of the retina, and we treat the retina with laser. So also one important thing about diabetes for all our audience to know is that diabetes is one of the leading causes of blindness in the world. So one of the leading causes of blindness in the world is actually diabetes. So it's very important to early diagnose diabetes in the eye and treat it as soon as possible. The things to do in order to prevent any complications from diabetes in the eye is yearly exam. Even if you don't have any problem in your eyes, you're not seeing any blurriness or anything, it's important to check your eyes yearly with an eye specialist. And important also to follow up with your primary care doctor to make sure that your diabetes is properly managed and your blood sugars are very well controlled. So, as I said, early exam and follow-up with your eye specialist is extremely important. Also, when you have complications with your diabetes in your eye, it's very important to see a retina specialist. At the American Eye Retina Center, we are specialized in treating retina problems in your eye. So this is very important. Yeah, this patient didn't know that he has diabetes and he started seeing black floaters inside his eye because his retina started to bleed inside his eye, inside his vitreous or shlay chow. We say here in Kurdish, shlay chow, khina la shlay chow. So, because he has uncontrolled diabetes. The good thing he's followed up at the American Eye Center because we are specialists here in retina and treating retina. We are the only center in the Middle East that is actually specialized in the treatment and diagnosis and treatment of retina. No other center in the Middle East has a specialty in retina. And that's why it is very important to go to a specialist in retina if you have problems with your diabetes. Retina surgery is a subspecialty after ophthalmology. So it's not just ophthalmology. After ophthalmology, you have to specialize in treating retina. And unfortunately, in the Middle East, there are not many doctors who are specialized in retina. In the US, you have to complete a fellowship 2 years after completing ophthalmology to be specialized in retina. That's why it's a subspecialty. And it's very important to go to a doctor who is specialized in retina. So diabetes can cause multiple things in your eye. It can cause cataract, AWI-SP. It can cause glaucoma, AWI-RUSH. It increases risk for glaucoma. Also, it can cause water inside the retina, so called diabetic macular edema. And this water inside your retina can cause your vision to be blurry. And also, again, and this is more advanced, it can cause bleeding inside your eye if it's not taken care of early on in the treatment process. So all these can cause blurriness, and they can lead to blindness if they are not treated properly. What to look for? It's very important to look, if you're diabetic, to look for any blurriness that is unusual. To see sometimes some of the patients with diabetes can see black floaters. These black floaters can be a sign of bleeding inside your vitreous or the Schleichow or the Sa'al Zujaji. So this is very important for you to know and to get immediate treatment with an eye specialist as soon as possible. So the treatment for diabetes inside your eye is consistent of many things. The most important thing is actually tight blood sugar control with your primary care doctor. It is very important to go regularly to your primary care doctor to make sure that your blood sugars are well controlled. The studies over 20 years ago has shown that patients who are on insulin are less likely to have problems in their eyes. So it is very important to start an insulin regimen with your primary care doctor so you don't get complications from your diabetes inside your eye. Another thing is injections. Anti-VEGF injections are very important for your diabetes if you have complications such as diabetic macular edema or water inside your retina. It is just like a garden that has inflated with water, and what you need to do is do injections to make sure that this water gets dry. So this doesn't affect your retina. So injections are very important, anti-VEGF injections, and also corticosteroids injections are very important to treat your diabetes. Another very, very important treatment for your diabetes inside your eye, for your retina, is laser treatment. Is extremely important. And unfortunately here in the Middle East and in Kurdistan, people are how do I say, they are it's difficult to say, but I think they have misinformed. This is the best word, is they are misinformed about the importance of laser for their retina, because they go to their friends and their friends tell them, oh, I got some laser and I got blind. But the patient doesn't say that he got blind because of the diabetes, not because of the laser, or he actually went very late to get his eye treated. So the blindness is not because of the laser. The blindness is because this patient went too late to get treated. So laser treatment since 1980s has been the gold standard treatment for diabetic retinopathy. So this is very important for all patients to know. Again, if the laser has not helped the patient or is not enough to treat the patient, then we do vitrectomy. Vitrectomy is when we go inside the eye, as you saw in the operating room. We went inside the eye and we cleaned all the bleeding inside the eye, and we put laser and treated that patient. So we are removing the blood. We removed about 75% of the blood right now. I can see that his retina is good when I remove the blood, so this is a good thing. I think he will do good. This patient will do very well, I think, because now I can see his optic nerve, can see the center of his retina. They are all fine. So this is very well. The patient is awake. He can hear us, but he's at the same time asleep. And this is the wonderful thing about the anesthesia we have here. Most places they go and they do general anesthesia for these surgeries. But here at the American Eye Center, we don't need to do general anesthesia. It's better for the patient to have this surgery under local anesthesia. So the earlier you come and the earlier you get treated, the better the prognosis for your eye, the better the results for your surgeries, the better results for your visual rehabilitation. This is important to know that vitrectomy has become more advanced lately, because the technology has improved so much. We can do the surgery under local anesthesia, and now the surgery takes about 45 minutes to an hour here at the American Eye Retina Center. I don't know about other places, but we are so much advanced here in Erbil and the American Eye Center that we can do the surgery in 45 minutes. So we would like to thank our audience at the Reng O Hank Show for following us, and I hope we to give more shows about other eye diseases that I think you may find very helpful. And at the American Eye Center, we're happy to take care of you with whatever problem you have, and we will see you soon, inshallah. Take care. Bye-bye.